Good morning, all. Good morning, all. A warm welcome to today's event, AyurSIM online training program organized by Amrita School of Ayurveda and Amrita Create. I'm Dr. Mehta MM, Research Associate from Amrita Create, Amrita Vishwavidyapeetham. This online program is meant to introduce the newly developed online learning platform for Ayurveda students called AyurSIM, an Ayurvedic virtual clinical simulation platform. Explains the features and utility of AyurSIM, demonstrates its various modules, and to introduce the virtual reality component of the platform. For today's training program, the esteemed panelists who will speak to you and introduce AyurSIM to you are Dr. Anup Thakur sir, former Director, Institute of Teaching and Research in Ayurveda, Jamnagar, Gujarat, and he also serves as the head and professor of Department of Panchakarma, ITRA, Dr. Mandeep R. Goyal, ma'am, Professor and Head of Department of Kaya Chikitsa, Institute of Teaching and Research in Ayurveda, Jamnagar, Gujarat. Dr. P. Ramanohar, sir, Research Director, Amrita Center for Advanced Research in Ayurveda, Amrita School of Ayurveda, Kollam, Kerala. Sundar, sir, Research Officer, Amrita Center for Advanced Research in Ayurveda, and Assistant Professor in Samhita Siddhanta Department, Amrita School of Ayurveda, Kollam, Kerala. I welcome our most respected panelists to today's program. Last but not least, I also welcome all the delegates present in the webinar who have registered and joined to attend this program. Thank you all. Before commencing the training, I will give a brief introduction to AyurSIM platform. The Ayurvedic Virtual Simulations AyurSIM platform is a revolutionary educational solution for Ayurveda students to learn patient assessments or Rogi Pariksha and disease assessment or Roga Pariksha by providing them with practical experience and exposure in a virtual environment. Integrating technology into Ayurveda education allows students to gain valuable insights and skills crucial for their future clinical practice. AyurSIM was jointly developed by the Institute of Teaching and Research in Ayurveda, that is ITRA, Jamnagar, Amrita Center for Advanced Research in Ayurveda, and Amrita Center for Research in Analytics, Technologies, and Education. The project was funded by the Ministry of Electronics and Information Technology and the Ministry of Ayush, Government of India. AyurSIM showcases virtual cases with both diagnostic and treatment modules. Using simulations, animations, and videos, it provides an enhanced learning experience of diverse range of clinical scenarios, which prepares the students for real-world patient cases. The virtual reality component of AyurSIM utilizes the most advanced virtual reality or VR technology to present Ayurveda treatment scenarios in an interactive virtual environment. Now, we shall begin the training program. I first invite Dr. Mandeep R. Goyal, Madam, the co-investigator of AyurSIM project, to begin our training program and give the introductory remarks. Welcome, ma'am.
Thank you, Dr. Mehta. Am I audible?
Yes, ma'am.
A very good morning to all the respected panelists. Dr. Professor Anup Thakur sir, Head and in charge Director of ITRA, Professor Ram Manoharji, Dr. Medha, Dr. Shyam Sundar, and all the other participants who have joined this webinar for the demo and online training of a educational tool which has been prepared by a joint venture of Institute of Teaching and Research in Ayurveda, Jamnagar, that is the Institute of National Importance, in collaboration with Amrita School of Ayurveda, Amrita Vishwa Vidyapeetham from Kerala. And as Dr. Mehta has said, this is a project which is being undertaken under the Ministry of Electronics and Information, and it's also being sponsored by Ministry of Ayush. So lots of thing has been mentioned by Dr. Medha, that what is the utility and why this platform has been developed. I will just be talking about how this whole process started and what are the important components and how it is going to benefit our young scientists of Ayurveda, specifically the beginners, the BMS student, and also for all the students of Ayurveda who are trying to catch up with the clinical practice of Ayurveda. So this was a project which nearly took more than 3 years, 3.5 years, which was being conceptualized just before the COVID condition, and with the thought that something should be provided to our young scientists to learn about Ayurveda in a manner they should understand Ayurveda and practice Ayurveda. So lots of brainstorming things were there before submitting the project to the MATI, and lots of modifications were done as per the requirement, and with lots of effort of Dr. Ram Manohar ji, Dr. Thakur ji, and the team behind it, we got the proposal approved from the ministry, and it was funded by the Ministry of Information and Technology and also from Ayush. So on this platform, I thank the sponsors, and also the efforts were being taken that whatever important components are required for the actual showcase of Ayurveda practice, all thoughts were taken place, and nearly weekly online meeting, because it was the time of COVID, we could not do the practices or could not discuss or communicate physically. Lots of discussions were taken place between the experts of ITRA and Amrita School of Ayurveda, and it was finalized at least some of the important cases which are usually seen in the practice. A BMS student, when he is completing his Ayurveda education and he is put into the public domain for the practice, some common conditions which are at least must for our Ayurveda student to understand and practice as per the Ayurveda were thought of, and such 54 cases were nearly detailed with the detailed discussion with the experts, with the peer review meeting which were taken place, sometimes virtually, sometimes physically. And with all these efforts, nearly after the 3.5 years, we are able to now start the showcasing of the contents which is being developed. And today's training program is just the first step, where after completion of all the efforts, now it is available in the form of a educational tool which is being where the students can just click on various aspects of the contents of the various softwares which are being updated with lots of information related to each disease, in particular related to the diagnosis, treatment, and the outcome aspect also has been considered. So I think when this educational software will be showcased to you, training will be or demo will be given by Dr. Sham Sundar and his team, you will understand how deeply and how minutely we have gone through the each aspect, and hope these efforts of the whole team and the experts will bring you to a new world of Ayurveda. With this, I thanks all for giving me this opportunity to speak on this occasion. Thank you.
Thank you, madam. Now, I humbly invite Dr. Anup Thakur sir, Chief Investigator of AyurSIM project, to deliver the presidential address. Welcome, sir.
Good morning to all of you. Uh, Professor Ram Manohar ji, Professor Mandeep ji, Dr. Shyam Sundar ji, Dr. Megha, and all uh, learned participants. Actually, three years back, when Professor Ram Manohar ji contacted me about this project, and when I heard and listened and we discussed about it, it was exciting as well as challenging. Means feeling of the challenge was there in my mind. Mixed feelings were there that how this will happen. And actually, it is a need of our. We all of us we know that there are many Ayurved colleges are there where theoretical knowledge is really being given in proper way and very systematically. But the issue is everywhere they don't have patience, enough patience, and in some of the places even patients are there, variety of patients are not there. So for the scholars of the Ayurveda, the biggest challenge is how to get the clinical exposure for the different condition. And you all of you know very well that in Ayurveda many clinical conditions are there uh, 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 for which you do not get patients everywhere. And so to meet this challenge, and also there is another issue is also there, that everywhere at every level, everybody explains the condition in the different manner, and different clinics explain with the different aspect or with different interpretation. So this software we were aiming to provide, the good clinical training to all the scholars throughout the India, we can say globally, and also it will help to bring, uniformity in the clinical practices in future. This was the biggest challenge for the team. Though we accepted the challenge, and when we started the things and started discussing, we came to know that in what we have ventured. And but slowly, gradually, when we started to work, uh, the way forward, we could we could see, and then gradually, whatever status we have landed today, we have developed that software. I'm sure that it is not a complete one. It cannot be, because this is the beginning, and I know that there will be many flaws. Many people may feel that this improvement or that improvement can be done. This can be done. Of course, it is all welcome, and always when these kind of things are being prepared and launched, they are meant to improve, and they are meant to, always. Uh, Upgraded. But the beginning was really difficult. But I must congratulate the team of the this IUSIM project, particularly Dr. Prema, Dr. Ram Manohar, Dr. Mandeep, Dr. Sham Sundar, and all other uh, faculty members who were involved in this really worked hard, because to develop all the modules, how to present it, how to design it, it was difficult. And there was no previous example or something. We have to think ourselves, and we have to develop the things. That was the biggest challenge. Of course, Dr. Ram Manohar will tell in the detail about the medicine, but in the medical field, the scenario is different as far as the clinical conditions are different. Clinical conditions are concerned. In Ayurveda, clinical conditions, there are many variables are there, many presentations are there in the different way, and all of above, every Vaidya has a different interpretation of that. And so it was a challenge in front of the IOSIM team, but overcoming all these challenges, really, I am really happy that at least we have ultimately able to achieve some really creative new software which will help Ayurveda clinicians community well, and it will really pave a new pathway in this direction, will open new era, that I'm sure about it. And in the era of the AI and the software and all those things, as far as the Ayurveda is concerned, this is the big leap I consider as, and definitely it will create history. So I congratulate again to all team for completion, successful completion of this project. We are just to going to just to launch this software, and I'm really thankful to all the team, AlSIM team, to giving me this opportunity to share my views with all the learned participants. Thank you.
Thank you, sir. Thank you so much. Now, I invite Dr. P. Ramanohar sir, the co-investigator of AyurSIM project, to explain the features and utility of AyurSIM platform. I welcome you, sir.
Thank you. Very good morning to all of you. I'm really happy to be present here to give a quick overview of AyurSIM. I mean, what purpose it serves and how it can transform the way clinical training is done in the field of Ayurveda. So AyurSIM is a short form for Ayurvedic virtual clinical simulation platform, and it's a first of its kind tool to be developed in the field of Ayurveda. So we know today that simulated training has become, mainstream in many fields, especially when in a real life scenario, when you perform maneuvers, procedures, if there are risks involved when executing it, simulations help the students to prepare for a real life scenario. So for example, in aviation industry, in vehicle, motor vehicle, when you're driving on the roads, you cannot experiment with a real car until you learn the basics and you are, fine-tuned to handle that. Otherwise, it can lead to accidents, mishaps. A similar situation exists in patient care also. Now, students, while we are learning, we always make mistakes. And those mistakes will have consequences. So when students learn directly on patients, there are chances that there will be mishaps and accidents. If the student is prepared through a virtual platform, then we can avoid these kind of mishaps. So this has become also now an ethical requirement. Considering the safety of the patient, students should undergo prior virtual simulated learning. This concept began in the times of Sushruta. We have the Yogya Sutriya concept in Ayurveda, and today with modern technology, we have brought AyurSIM before you. So we know that even modern doctors, especially surgeons today, before they do perform surgeries, they practice their surgery on a virtual platform. The virtual platform recreates the entire surgical procedure scenario, giving them live feedback. If procedures go wrong, what will happen, how to handle it. So in complicated surgeries, physicians work on these simulations first, practice it many times before they actually go into the theater and perform on the patient. So that is the primary purpose of AyurSIM. Today, when we are undergoing clinical training, there are many patients, many students also. And each student may not be able to get a chance to interact with the patient, examine the patient during their clinical training. So there are a lot of gaps in learning. A student wants to examine the patient respiratory system. Maybe one or two students will be able to examine, others will just have to observe, and you may not get thorough with all the procedures. And it's only when you see a patient yourself that you may be doing it thoroughly, and when you're doing it for the first time, mistakes can happen. So in order to prevent that, somebody is mentioning that my voice is low. Is it very low? Let me just check my settings.
No, sir, you are audible.
Okay. Now I've increased the input volume of my microphone. Is it better now?
Yes, sir.
Yeah. Okay, thank you for pointing that out. So this is the context in which AyurSIM has been created. Now the idea is with AyurSIM, the students, clinical students of BAMS, especially that is the group we are targeting, their first exposure for a clinical training would be ideally on the AyurSIM platform. The first patient they encounter will be a virtual patient on AyurSIM platform. So the advantage is that they will be able to elaborately go through every system. The patient is available for them completely. They can take all the time in the world to go step by step, go through all the, procedures one by one, repeated many times, identify the mistakes, and develop the confidence before they actually see a live patient. So if you have these kind of repeated trainings on, so we'll explain now 54 patients. If you really get trained in clinical examination of 54 patients on AyurSIM platform, you would have developed the kind of speed, skill, and sensitivity when you really see a real patient. I think this can really revolutionize the way clinical training is done in Ayurveda. So these are some of the advantages of the AyurSIM platform. Another aspect is that, see, when in Ayurveda, patients come to us for chronic diseases. So it's a continuum of care. And if you look across that continuum of care, we are seeing the patient only in one particular time point. You may not even be able to follow up a patient completely because by the time your posting will change. So you have seen only patients in bits and pieces. This is a big challenge for Ayurveda students. Many of them some patients may be undergoing treatment for 2 to 3 years before they are getting a complete outcome. But in your training period, you may watch that patient for maybe only 1 month or 2 months. So you do not know what happened at the end. Did the patient really get better? So we need to create a timeline of that covering the whole continuum of care so that students can understand what is the prognostic outlook, what is the final outcome of the treatment. AyurSIM platform is that creates that kind of accelerated platform where you can see the entire timeline of the patient. You can see how many times the patient came for follow-up. So what happens in 2 3 years, you can reduce it into a timeline of 1 to 2 hours. You can see the entire encounters of the patient. So this is another kind of feature of AyurSIM. Now, the AyurSIM, as we already mentioned, has been primarily funded by the Ministry of Electronics and Information Technology, with also a supportive uh, funding from Ministry of Ayush. And it's a collaboration of the Institute of Teaching and Research in Ayurveda and Amrita Vishwa Vidyapeetham. So AyurSIM is a virtual patient case simulation platform. It provides you various activities. So Dr. Shyam Sundar will very shortly demonstrate the activities. Activities are procedures that you have to do when you use this platform. At this point of time, this is an online web-based platform. So you need good internet to be able to interact with this platform. Maybe in the future, this could become an offline app, but at this point of time, it is online. And it can be opened on any browsers using the link which upon registration you would have received. So the platform is designed to help students develop clinical reasoning, clinical judgment, communication skills. It allows a personalized learning and gives immediate feedback. So like sometimes it's a checklist which you have to tick. And if you make a wrong choice, the system gives you a response. That tick mark may become red, or there may be a beep, a red traffic light will show up. So this gives you instant feedback whether what you are doing is right or wrong. So in this way, when you repeat the procedures for 54 patients, you will reach a point where it's very difficult for you to make a mistake. When you see a real patient, everything, your mind has already been programmed by this virtual training platform. You know what should be done. This all in Ayurveda. Pratipatti Jnanam. So a well-trained person has Pratipatti Jnanam. Pratipatti Jnanam means having no hesitation. When you see a patient, I know exactly what to do. What is the first step? What is the next step? What is the next step? And there's no hesitation. If you are not well trained, when you see a patient, you have a lot of doubts, and you may mess up the whole thing. So this is a challenge faced by Ayurveda physicians. So AyurSIM will, through a Yogya Sutriya approach, it will create what Charaka has called as Pratipatti Jnana. So it's a patient-centered approach to communication, examination, and care. We have elaborate Rogi Pariksha module. It encourages safe healthcare management practices. The AyurSIM platform covers 9 clinical specialties in Ayurveda with 54 cases. It has 6 modules and 150 plus simulations. So we have various modules. It's a very logical workflow. You start with the patient, then you assess the disease, and based on the assessment, you plan the treatment. The treatment planning happens in 2 phases. One is you assess what you work out a treatment plan. The treatment plan is different. Now, this is inspired by our classical texts, which says that everything begins. Darshana sparshana prasnai parikshedacha roginam. That is the classical, basis for starting this whole process with rogi pariksha. Darshana sparshana prasnai. So darshana, of course, here it is a digital sparshana and darshana and prashna. But all these elements are included in this virtual platform so that rogi pariksha happens as described or as instructed by the classical texts. Then comes Rogam Nidana Pragrupa Lakshanopashyaptipi, that is Roga Pariksha. So after Rogi Pariksha comes Roga Pariksha. And based on Roga Pariksha, we will do Aushadha Nirupanam. Rogamadav Pariksheda Tadanandaram Aushatham Tata Karma Bhishak Paschat Jnana Purvam Samajare. So combine synthesizing the messages given in these verses from Ashtanga Hridaya and Charaka Samhita, we have created the 6 modules. After that comes the result, which is the phala, and then the anubandha or the follow-up. So phala, we are now, I prefer to call it as Siddhi Vimarsha. And so what we have is Raksha, Rogi Roga Pariksha, Aushatha Nirupana, Kriya Krama, Siddhi Vimarsha, and Anubandha. So this Raksha, which means protection, it's a kind of safeguard to make sure that the students don't harm the patient. And we protect the logic of Ayurveda from being distorted by giving students sound training in this logic. So National Education Policy also points out that we need to give equal access to quality, practical, and hands-on experimental-based learning experiences. And the AyurSIM platform makes this available to the entire Ayurvedic community. So it includes all clinical departments under BAMS curriculum, virtual patient cases, which helps the students and faculties to prepare for real.
I'm sure, sir, your connection is getting interrupted.
Ayurveda of young Ayurveda clinicians. Now, the target is BAMS students. It's a responsive mobile first design concept. These are all, the technological aspects. The specialities covered are Agada Tantra, Kaumara Bhritya, Kaya Chikitsa, Manasa Roga, Panchakarma, Prasudi Tantra and Stri Roga, Shalakya Tantra, Dental and ENT, Shalakya Tantra, Ophthalmology, and Shalya Tantra. So these 9 specialities are covered. And now this is in alignment with SDG goal 3 and 4, good health and well-being, quality education. Now here are the features in a nutshell. There are 2 labs, virtual platform and virtual reality. Today we will just show a video which will give you some idea about how the virtual reality platform will be. In order to demonstrate the virtual reality platform, we need offline training because you will have to use a VR technology device. You have to wear it before the virtual reality scenario is created in front of you. This cannot be demonstrated in an online mode. But when you put the VR device, you can see that the whole scenario is created in front of you in a 3D format, and you will be able to interact with that virtual reality and you will get feedback. You can actually perform procedures in a virtual reality environment. So this is also a first of its kind attempt in Ayurveda. What we have done in this stage of development is to have one VR module on Nasya Karma. And you will see a video demonstration of it. It covers 54 clinical cases with 1 VR. And I already mentioned, I'm not repeating it. The departments covered and the modules are Rogi Pariksha, Roga Pariksha, Aushatha Nirupana, Kriya Krama Phala Anubandha, and training and assessment. The features are, it It can address needs of medical faculty, medical students, online assessment, and there is a dashboard for learning analytics data. So there's just one point I want to mention, that, in modern medicine, there has been a development of format for uniform clinical case taking. In spite of modern medicine having so many objective modules and frameworks for systematic rational documentation of cases, physician to physician variation in documentation was noticed in modern medicine also. So in order to unify, see, elaborate case taking is very complex. We know when we study as a clinical student, we have to fill case record forms, and they are very, very elaborate. A busy clinician will never be able to fill that. So in modern medicine, a simple format, intuitive format was created. This is called as SOAP. It was known as SOAP notes. It has now expanded into SOAPIER, SOAPIER. Now, I'll tell you that our framework, the modules for Roga Pariksha, Aushadha Nirubana, Kriyakrama Phala, and Anubandha were actually created with an inspiration from SOAP. So SOAP means Subjective Objective Assessment Plan. This is a very simple framework for making clinical notes. First, you look at the subjective experiences of the patient. Then, based on what you learn from the subjective experience of the patient, you get some directions. What are the objective assessments to be made? Combining subjective and objective findings, you will be able to do the assessment of the disease and arrive at a diagnosis. Based on the diagnosis, you will be able to plan the treatment. And then based on the feedback or outcome, you can keep iterating again and again till, you reach the end point of healing the disease or improving the condition of the patient. We realize that in Ayurveda, we cannot use SOAP. SOAP has become a very popular method of taking clinical cases in the United States. There are softwares, platforms available. But in Ayurveda, we realized we need to modify it. So we have created this framework called Raksha. Roga Pariksha. Rogi Pariksha has both subjective and objective components. So it's also aligned with the SOAP, but the framework is adapted for Ayurveda. So Rogi Pariksha involves subjective experience of the patient, objective findings of the physician. And then Roga Pariksha corresponds to assessment. And plan in Ayurveda has two components, Aushadha Nirupana and Kriyakrama. Because Charaka, as I mentioned, रोगमादौ परीक्षेद तदनंतरम औषधम ततकर्म भिषक पश्चात ज्ञानपूर्वम समाजरे. So Kriyakrama and Aushadha Nirupana, our acharyas have separated. That is why we have made it separate here. And then the phala, as we otherwise call it as Siddhi Vimarsha. Siddhi in Ayurveda means success of the treatment. So after you have treated a patient, you have to check whether the treatment is giving the expected results or not. That analysis is called Siddhi Vimarsha, or in other words, Phala. And then if you have not achieved that goal, you have to repeat this whole process. Again, do the subjective, objective assessments, Rogi Roga Pariksha, and then rework the Aushadha Nirupana, if necessary, modify the treatment or continue the treatment and keep assessing the Phala till the patient reaches the point where, he or she is healed. So this is the framework of AyurSIM. And here is a quick glimpse of the various activities. So Dr. Shyam Sundar will explain to you the AyurSIM and a patient is. Activity means something. In that process, you learn something. Into an audio. You may be watching an animation. Based on that, either you will be given some information based on which you can make a judgment, or you may be asked to take a decision based on what is shown in front of you. Otherwise, it's a simulation. A simulation can be very interactive, like you will see very shortly how the blood pressure is measured. You can actually inflate the cuff, deflate it, watch when the heart sounds are heard, and then take a measurement of the blood pressure. Some activities are in the form of videos, some others are images. And here is a feel of how the platform looks like. You can see the horizontal bar contains the various modules. They are like tabs. You can move from one tab to the other. And the vertical bar includes the various modalities in which you interact with the patient. So these are the encounters. So when you choose each tab, the horizontal tab, the vertical tabs will change, and then you will be shown various interfaces where you can interact with the patient, and that will be displayed in the central part. And then you have some other information on the right extreme. So in this way, an interactive module has been created. So here are some images of how the AyurSIM platform looks when you interact with it. Now, modern diagnostic methods have also been incorporated, because as Anup Thakurji was mentioning earlier, in the field of modern medicine, such simulations are already available. And Amrita Create is the brain behind these simulation modules. Amrita Create, led by Dr. Prema Nedungadi, had already developed a platform called MedSim for modern medicine. And in that, a lot of investigative procedures, diagnostic methods were developed. So we have integrated that, added some more, and customized it for Ayurveda. You will find a lot of simulations and activities which introduce you to modern methods of diagnosis. And then, as I said, this is a VR module. And right now we have Nassim. In the future, we hope we will be able to add more VR scenarios and also link it with physical interfaces like mannequins. Like, for example, you have a mannequin connected to AyurSIM, and then you are trained to actually locate the marma. Specifically, when you locate the right point, then the system will give you a feedback that you have located it correctly. There are possibilities of having mannequins, which simulate surgical scenarios where you will be able to insert Shara Sutra, learn how to tie the thread. So all those are future possibilities. But at this time, we have just one VR module. So this is the platform. When you enter into the platform, you have an option to register. After you register, you can use this platform for free. It's a free tool. And once you enter the platform, there's a demo, there's a user manual. So all this will help you to learn how to use this platform. So this is a platform URL. You can access this by typing this web address. So this is an overview of the whole platform, and I will conclude here. At a later point, you will be asked to scan this QR code and give some feedback on what you feel about this platform. So thank you so much for your attention. I will conclude here and hand over now to Dr. Shyam Sundar to continue with the demo of the platform. Thank you very much.
Thank you, sir. Thank you so much. Next, I invite Dr. Shyam Sundaran K, sir, to demonstrate the various modules of AyurSIM platform. Over to you, sir.
Thank you so much, Dr. Medha. Yes, as the previous speakers have given you an overview of how this platform actually was made, and who were the funders, and what was the idea behind it. How does the whole framework look like? Now, you would be eager to actually know and feel how this whole uh, platform is like. So, not making you wait further, I will just show you the platform immediately. So let me share my slide, the screen. So hope you are able to look at it. Are you able to see it? Yeah. So yes, so this is how you will be able to see the AyurSIM portal when you log in. So you would have got a registered email ID and you should make a password. And with that, when you log in, when you click login, you will right away land in a home page. This is the home page of AyurSIM portal, wherein you can see the different tabs. These different tabs represent the different 9 specialities in Ayurveda, and each of them have 6 clinical cases under that. So each of it will have clinical cases. So the idea was like our funding agency, the Ministry of Electronics and Information Technology, was very particular, and Ministry of Ayush, they were very particular that this portal should be used by everyone. It should not be, just for Kaya Chikitsa or only for certain kinds of diseases. So that was the whole idea. So, and they wanted the whole of the Ayurveda community to be, to be using this platform efficiently. And that is why we were told to represent all the 9, specialities that we have. So that is why we represented all of them in our portal, which is Agada Tantra, Kaya Chikitsa, Kaumara Bhitya, Manasa Roga, Panchakarma, Prasuti Tantra, Shalaki Tantra, dental and ENT, then eye, Shalya Tantra. So all of this are the 9 modules. And under when we have chosen the 6 cases, what we had in mind is that, as Dr. Ramanohar sir had already mentioned, that this portal is mainly for undergraduate students, the BAMS students, keeping in mind their view. We have actually taken the consensus as this was developed from ITRA and Amrita School of Ayurveda, both in collaboration. So what we have done is we first had to identify at least 6 cases which represent a department. Like, for example, these are 6 cases which, any BAMS student passing out after their 5.5 years should be invariably, efficient with. So these are certain 6 cases that we have identified. This also came by the consensus of both these specialty. Like, for example, the Kaichikas department of Amrita School of Ayurveda had enlisted certain number of cases which they feel are most important. Then the same counterpart in ITRA did the same exercise, and they each of them had dialogues in between. They had meetings, and after that only it was decided that these will be the final 6 cases under each. So that is how we have enlisted. So ultimately, what you would see in this platform is that they are the most important or the most required cases at a first stage. Like, this is the first phase of the project. So at the first stage, what should be the minimum cases which should be there in a platform? So that was the whole idea, and that is how we have developed the different cases here. And here the module is like you can see all the 54 cases here in one tab. It is called, under the all tab. Or if you want to identify, if you want to only see Agada Tantra, like some teachers may assign only their department cases to their students to see how they are performing. So teachers can assign Agada Tantra cases or Kaya Chikitsa cases like that. So that option is also there. And once you have entered into one particular case, so as soon as you enter, uh, as like in a clinical setting, when you're sitting in an OPD, the first thing that you see is the patient walking into your clinic and talking to you. The same has been depicted here. Patient is made, is present right in front of you, and it is represented by a small video. So in that small video, you can, when you play that play button, you can hear uh, so you can hear the patient speaking to you. And yes, of course, this is, from the department of, from the ITRA, and that is why most of the cases are, sometimes in Gujarati. But nevertheless, we also have the, option of, subtitles. So it will tell you what the patient is telling in English, so that the language will not be a problem. So at this stage, I would also like to tell you that ITRA Jamnagar was responsible for actually giving us these varied number of cases, and all these cases are taken from ITRA Jamnagar. So this is the first tab that you get, and it is about the Rogi Pariksha. So under Rogi Pariksha, the first thing that comes is the patient encounter. So which we looked at, and after having heard the patient, you will go to the subjective symptoms. Subjective symptoms, as you all know, is what the patient feels. So again, it is the listening of the patient. So listening of the patient, when you click, again, it is the audio wherein you will hear what the patient has to say to the doctor. And this is what you also do in a clinic. So this is to make the student understand that the first thing you ought to do in a clinic is that to listen to the patient carefully, to listen to the patient patiently. So here you will, when you hear what the patient has to say, then right from there you start the history taking. So then the history taking starts, and you know how tedious, how many aspects you need to consider in a history taking, right? You students from second year, or right from second year onwards, you know how tedious history taking can be. So that is why, uh, all the aspects of history taking has been enlisted here, as any other textbook of examination would be there, or diagnosis would have representation of. So initially you will look at the local location or radiation, onset, chronology, quality, severity, modifying factor, associated symptoms, treatment, personalization, all of these. Only when you come to know about all of this will you get a whole picture of what the patient is suffering from. And having said that, it is also important. So you will not, especially in Indian setting, you will not get sufficient time to examine the patient for more than at least half an hour. You cannot spend, or you cannot afford to spend more than half an hour or at least 20 minutes for a single patient. So what do you do? So if you are doing, or if you are examining the patient, it should be very short and sweet, which means if you are asking questions to the patient, having listened to the problems of the patient, it should be in a manner that it gives you the whole idea of the patient, and is in the most time efficient way. So this is the learning that you get. So here also, when you click each tab, there are a set of questions that the doctor can ask to the patient, or the doctor is going to ask to the patient. So depending on that particular disease that we have chosen, there may be different types of questions represented. So here you can see, can you describe the location of the pain in your knees? Or is it a specific area or all over the joint? Is the pain radiating? These are some questions that you may pose to the patient. But here the learning is, you should not ask irrelevant questions. So how do you make the student understand this? It is by this simple idea. See, when you give, the answer is here, this is the answer, and this is the question. So this is the answer given by the patient. I am having pain on my both knee joints. And then the next question is it in a specific area or all over the joint? So I am having more pain in the inner side of the knee joint. Then the question is the pain radiating? So this is also, so the learning is if the questions are all relevant, then you will get a green signal, which means you're asking a right question. But at some places, you may see that the certain questions are not required to be asked. So that gives a sign that, uh, the pain, such questions are not to be asked. So most of these questions are green, which means these are all relevant questions, right? Yeah. So we will go through each of them like location, onset, chronology. So this is one method of the representation in AyurSIM, that is having a traffic light signal wherein the questions which are correct will give you green color and the questions which are wrong will give you a red color. So here the student will learn that what are the specific questions which need to be asked in that particular case. So you will not, if you are thorough with these questions, or if you at least get an idea, if you have spent sufficient time using this module, then you will know, these are, questions that I shouldn't miss when I see such a patient in the clinical setting. I see some people raising their hand. May I ask what it is? Can you please provide the link of the platform on email after this session so that I can, yeah, yes, those things will be really shared. Sorry. Is there anything that you're wanting to tell? You can please put it in the chat box, and the question and answer session will be at the last. So yes, so this was about the patient encounter and subjective symptoms. And coming to the objective symptoms, again, the physical examination comes, the mental status of the patient comes, the Dashavidha Pariksha comes, the Srotas activities comes. So here again, the learning is, this I think all the students and even the teachers would agree upon that, even though we study the Ayurvedic aspects of examination, like the Srotas Pariksha, the Dashavidha Pariksha, the Ashtasthana Pariksha, the Nidana Panchaka, or you name anything, you would have learned it in Ayurveda when you're studying. But when you're or you would have even learned the examination technique, like the modern examination techniques, like subjective symptoms, objective symptoms, all of that. But when you're sitting in a clinical setting, the patient or the student especially is really confused as to where this thing has to be fitting into. Like, where do I fit this Dashavidha Pariksha in my examination in a clinical setting? Or where do I fit this Srotas Pariksha in the clinic? So there is a logic behind, or there is a flow behind it. That is what Ramanohar sir actually explained to us. So this is the representation of that flow. First, we do the Rogi Pariksha, then the Roga Pariksha, and with the Rogi and Roga Pariksha, that the information that we get, we do the Aushadha Nirupana, and then from Aushadha Nirupana, we do the Kriyakrama, and we look at the Phala, and then we look at the follow-ups, that is the Anubandha. And under each of them, you will see that even the Ayurvedic aspects, such as this, the Dashavidha Pariksha, the Srotas activities, all of this are embedded here in this framework. So this makes the student understand, oh, so Dashavidha Pariksha comes under Rogi Pariksha. Srotas Pariksha comes under Rogi Pariksha. This is a very important learning that the student should get. Without this, the student feels, they are lost, like, they don't know where to apply this in the practical aspect. So this gives that, whole training about it. Then in the objective, you will see the physical examination, and of course, you will have to look at the vitals, right? So we have again made that very interesting. So just when you click at the vitals, you will see the modern parameters like the blood pressure, the temperature, the pulse, respiratory rate, BMI, and each of them are simulations. And again, blood pressure, like everyone knows how to do the blood pressure right from first year you're learning. But the problem is there is a lot of variation from person to person measuring blood pressure. If student A measures blood pressure, he would get 110 by 80. When a student B checks it, of the same patient, same time, they may get slightly different. So the reason is the method of doing. So the method of proper way of, even checking a blood pressure is very, very important. So here is a checklist which we have standardized, which you need to look at and answer. So this is also an interactive thing. You have to actually answer and take the right questions. And if you feel these are all correct, you just tick them and confirm. So this is actually interactive. It is based upon your input that the computer is telling you if the thing is right or wrong. So once I confirm, you will see here, see whatever I have chosen and what the computer says will tell you. So ensure the patient has taken food or drinks within 30 minutes. That is not the method. So that is not a red thing. So the red thing means which is wrong. But ensure the arm is supported at the level of the patient. This is important when you're taking the patient's BP. Ask the patient to move any tight clothing from around. These are certain things which are very important when you're checking. So this is actually a very important learning even before you attempt to doing a blood pressure. So under each module, just like this, you will find this instruction of how you are supposed to do, which is a very, very important learn. So having done this, you go to the next thing. And here what you see, here you see the BP apparatus. So how do you want to do the examination of the patient? Is it sitting or is it standing or is it lying? So once I choose standing, then I click next. You get all these separately. So now the learning is you have to, so this is another activity wherein you are dragging and dropping the thing. So you have to choose sphygmomanometer or digital, whichever you want, you can choose. When you choose sphygmomanometer, you have to first put the handcuffs. So this is the learning. So you have to place it properly. Only when you place it at the right place, the sphygmomanometer will stay there. If you don't place it at the right place, it will come back. So that is also very important learning for the student. Then you have to place the step at the right place. If you place it wrong place, it will not stay there. See. So you have to place it properly. So once you have placed it, you have to inflate the BP. And when you do this, you can even hear the sounds. And as you release it, you have to hold it to release it. So this is an activity. And once the BP, reference range comes, it will start to beat. So the student will actually be able to listen to the actual sound and see what is the right method of doing it. So these are very important learning things, and student will also try to, enjoy in this manner of learning. So that is why, and it is not monotonous. We have made all these activities very dynamic, very different. Each of them are, very interactive, and only based on the students' inputs, the whole portal works. So that is a very important learning for the student. It makes the learning interesting. Looking at the temperature, see there are different methods. So oral temperature is there, rectal is there, axillary is there, tympanic. These all of them are represented here, and their reference range is also given. So the student will know what is the actual normal reference range and how these activities are to be done. So all these are simulations. So I'll just show you this also. These are the standard values. So once you have checked the temperature, it will show you the temperature here. The pulse. See, when you're checking the pulse, it is important to see where exact point you have to hold. And once you hold, you will also see the pattern, how the pattern is. That picture is very clearly seen. So the patient will, so how long should you see the pulse? That is also given here, the clock. The respiratory rate. Once you start, there is a small clock which will tell you the time in seconds. And after the whole thing, how many times you have counted, you can look at that. Again, the BMI. So based on the height and weight, you can adjust these. And based on this, the BMI will also reflect. So this is also a BMI calculator. Depending on the height and weight, you can calculate the BMI here. Then there is visceral fat. So you name any examination which are required for patients that is there in this, specific to that particular disease. And otherwise also, the whole examination is there for everyone. So one thing that you may see is that all the examinations are present for all the patients here. So you may ask, why is that? We don't do all the examinations, all the patients. So why is it represented in that way? So the answer is because when you're learning, you should have the option of doing all the examination in case you require to. So while I examine the patient has not disclosed any cardiac issues or anything. But while I examine, I suddenly understand that the patient also may be having some cardiac issue. So I should have the option of even doing the cardiac examination. That is how in clinical setting you see that, right? So similarly, that option is given, and whatever you want, whatever examinations you want to do, you can take it up and do. But whatever is relevant to that particular case is represented in this. Again, in a general examination, it is in general examination that Ashtasthana Pariksha, Shadanga Pariksha, Indriya Pariksha, Srotas, Ojas, all of that comes. So this is also an important learning. And under general examination, you know what things are. So pallor, clubbing, icterus, cyanosis, lymphadenopathy, all of that are shown as different activities. See, these are pictures. Some are images, but some are activities. So when you press it, it will zoom and show you the hand. So you can check for the cyanosis here. and decide. And you can even zoom in and zoom out. So all of these options are now here lymphadenopathy. Where should you examine the lymph of a patient? So what are the different places where you have to examine for lymphadenopathies? So each place is given like this. And when you choose that, how what is it in this particular patient? That answer is shown as a text. And how it should be examined. That method is also shown as a picture. So you will not miss anything, how a particular uh, method of examination is. Everything is represented here. Pedal edema. Where are you supposed to do the pedal edema? Where are you supposed to do the or look at the peripheral pulse? So these are the certain points. So we have considered, taken all the standard textbooks. We have referred all the standard textbooks and incorporated the things. So again, the JVP, how do you examine the JVP? You can even elevate and decrease. So if it is normal range, when it comes to normal range, it becomes green. So everything is very well, very student friendly and very easy to do things. Again, when you see the Ashtasthana Pariksha, Nadi, Mutra, Mala, Jiva, all of these are represented. So here, see, it is also represented as graph. So this is a Vata Nadi, which shows this is how the Vata Kapha Nadi would be. See, this is the finger which tells you about the Vata Nadi, and this is the finger which tells you about the Kapha Nadi. So this is a learning, and how you should place the fingers. This is also a learning. And how you will feel, how would be the pulse. This is also represented here. So it is a very important tool for students to learn. Mutra Pariksha. This is an image. By looking at the image, you have to identify. Whereas in Mala, again, it is, you know, different types of Mala this is called as the Bristol stool chart, and which is there in modern medicine. And based on that, you can also decide, is it a Vata Pitta? So see, this is typically Vata type of, Mala. And this is Pitta or Kapha, like that. So all of that you can even identify according to modern and Ayurveda. Again, Shabda is again a sound. So this is audio type of activity wherein you have to again play the sound of the patient and look, hearing the sound of the patient, you have to identify if it is a Prakrita Swara or Vikrita Swara. In certain cases like Swarabhanga or certain disease conditions, you may have a altered sound. So that will also be represented. Drik. So under Drik, what are you supposed to look at? You're supposed to look at how the eyes are. Again, Akriti means the build, gait, and posture. So this is also an important. So nobody knows. Very few people or very few students may know that Akriti means combination of build, gait, and posture. So what you have to look in the build, what you have to look in the gait, and what you have to look in the posture. Everything is mentioned there. So patient will never miss this. This will be very clear in their mind that in Akriti, when you're looking for Akriti, they have to look for build, they have to look for gait, they have to look for the posture. And here again, gait is a video wherein the patient is walking in a typical manner, which you can remember. Then comes the Indriya Pariksha. So Indriya Pariksha also is very, very elaborate, like each examination. So eye is a very, sophisticated organ, and it has a lot of examination. All these activities are given. See, you can move this and the patient will tell you. As you move it, the patient will make the, sounds which are pointed to, and the answer is given. So the patient details, everything will be given here. Similarly, nystagmus. The nystagmus is here. you are checking for the nystagmus or color vision. So color vision numbers are there, and the patient is supposed to tell the response. So he is able to hear and he is able to see this properly. 74 is the number represented here. So under each of these, everything is mentioned. So under Rogi Pariksha, it is very, very elaborate. Again, mental ojas. So under ojas, what are you supposed to see? Nobody knows what what are the things which come under ojas. So ojas means the mental status, the stamina, the immunity, and aging. So combined, all of this is what is called as ojas. So the student is able to learn this. So what is the stamina of that particular patient? How is the immunity? How is the aging? All of that is there. So that is what is represented by ojas. Again, in mental status, what are the different things you have to consider? So it is buddhi, samyagana, smriti, bhakti, shila, cheshta, achara, and man. See, whatever we have represented here in this portal is from the classical references. We have not taken anything or most of randomly. So all of them have references because of which they are represented here. And in future, we are also planning to, give you the references of all of this. So again, after doing the mental examination, the Prakriti, Vikriti, Sara, Samhanana, they are all just texture, and you will get the answers of each of them right there. So the student is able to learn all of this in such detail, which is not possible in a real patient. How much can you ask a patient? And how many people can ask a patient? There is a limitation for it. But here you can play with this portal as and when you want and learn. And which makes the learning also fun. Shrotas examination, you do the coordination test. So gait assessment is there, heel to toe. So all elaborate examination, you name any examination, it is there here, if it is relevant to that patient. So everything is represented here. So after getting the Rogi Pariksha, then you are supposed to see what is the Roga in that particular patient. So then comes the Panchalakshana Nidana. So under Roga Pariksha is what Panchalakshana Nidana comes. This is an important learning. Otherwise, student will not know where the Panchalakshana Nidana comes. Again, Rugvinishaya. Is it an Ukta Vyadhi or Anukta Vyadhi? This is also a very important page. Students don't know if a particular disease is Ukta Vyadhi and what is the big deal if you identify a particular disease as Ukta Vyadhi or Anukta Vyadhi. The only difference is that Ukta Vyadhis will have a Chikitsa Sutra already mentioned in the text, and they just have to refer to that Ukta Vyadhi Chikitsa Sutra and maybe modify little and do the treatment. The work is easier. But for Anukta Vyadhi, there are a different set of approach which you need to take. You have to look at the dosha, you have to look at the dushya, you have to look at the sthana. So there are many factors which go into when you are considering a Anukta Vyadhi and then arrive into a Vyadhi Vinishchaya. So the approach is entirely different when it comes to Anukta. So how does it change? All of this is represented in this. And that is also a very important learning, which you usually don't students learn. And again, here, after doing all these examination, the allopathic diagnosis is mentioned. Allopathic diagnosis is mentioned under Roga Pariksha because after doing all of this, patient may also come most of the time in a real case scenario for an Ayurvedic doctor. They will come with some report saying that I have already gone to a modern doctor and they have diagnosed my condition as ONE. So that is also there. And they may also show you some lab investigations or image pictures or something like that. So that is also represented here. See, whatever examination results are there related to that particular condition is represented here. So CRP and ESR is a very important aspect when you have to look at, osteoarthritis. You have to also look at vitamin D deficiency. You have to also consider calcium. These are very important things that the student will learn, and they will not miss the next time they see a patient of OA. Which is nothing but action. So after doing the data collection, you're with this data, you are going to decide the Aushadha Nirupana. But before doing the Aushadha Nirupana, you should first have the idea of Ama Vikalpa, which is how much Ama is there? Is it Alpa Ama, or is it Madhyama Ama, or is it Bahu Ama? And what is the type of, or what is the quality of Ama? Is it the Achala Ama, or is it Chala Ama? And again, the type, is it the Vidagdha Ama or Vishtabdha Ama? All of this are very, very important to plan the line of treatment. And based on this, you will finally come and decide, is it is it a Langhana Sadhya Vyadhi, or is it a Brahmana Sadhya Vyadhi, or does it require a Rasayana Sadhya Vyadhi, or is it a Shastradi Sadhya Vyadhi? All of this are, you have to choose. And as you choose, the green and red tick marks will help you identify what is correct and what is wrong. So this is also making the student learn which is the approach they have to take. And having done that, so this comes under the Aushadha Nirupana. Having done this is about the Ama Vikalpa. Then there is something called as Dosha Vikalpa, wherein you have to decide the dosha. So each Lakshana of that is mentioned here. And Bahya Chikitsa, you have Udvartana, Dhanya Amladhara, Ruksha Churna Pindasveda. All of these methods are there. And again, Abhyantara, you have options of Kashaya, Churna, Sneha, Gulika, all of this. And as this disease is particularly not Shastra Sadhya, this option is blank. Again, you have to look at the Sthana Vikalpa, wherein which Sthana it is. Is it the Dvaibahu, Dvaisaktini? That is to be looked at. Again, the Roga Marga has to be. So Roga Marga comes under Sthana Vikalpa. This is an important learning for the student. Student does not know that. And again, the Pradesha has to be looked at. Avayava has to be looked at. So based on that, you will decide, is it between the Hrid and Nabhi, or is it below Nabhi, or is it above Nabhi? All of this you can decide here. Then based on Ama, Dosha and Sthana Vikalpa, you decide the internal medications of the patient. So again, as soon as you see, for example, an osteoarthritis case, in your mind, you may have a big list of medicines that comes to you. And in that big list, you may choose one or two medicines. This is how the logic works, right? So similarly here, we have the big list of kashayams, the churnam, the snehas, the gulikas, all of that. And based on your assessment, you will choose the right one. So here it is drag and drop method, wherein you have to choose the right medicine and drop it. And if it is not suiting to that particular thing, then it will not stay there. So first you have to choose and decide if it suits to that particular dosha or not. And it is not enough that it suits to the dosha, it should also suit to the sthana. Next. And once the sthana And from this, so you have a set of medicines for dosha. From this, you have to drag and see if it falls under sthana. Ultimately, the learning is the medicine should be suitable for dosha, it should be suitable for the sthana, and suitable for the ama. And finally, if when you finish this activity, you can check for the compatibility. And it will give you red and green signals like that. Similar is in external therapy, same activity can be taken up. So this is a lot of variation where in Ayurveda this place is most complicated because from Vaidya to Vaidya there can be very different options. So we have given most of the options. Again, we are open to add more and more medicines, and we will be surely doing that in future uh, phases of the project. But anyway, this is the primary list that we have made. And again, finally, you have to look at the dosha aushadha nirupana, which means after finalizing the internal medicines and the medicines for external therapy, it should be compatible to dosha, it should be compatible to desha, bala, kala, anala, prakriti, vaya, sattva, sattva. So it should be compatible to all of this. Only then you will be able to select them for your treatment plan. That is Kriya Krama. So you have decided, you have now all these sets of medicines available with you. And see, you would have seen that all of them are different types of activities. Some are simulations, some are pictures, some are videos, some are animations. So the student will never get bored. Again, when you are doing the Kriya Kala, you have to decide at which stage the disease is. Is it at the Sanchaya state? Is it at the Prakopa state? Is it Prasara? Because based on Sanchaya, Prakopa, Prasara, everything, your treatment modality, your approach, again will vary, which you very well know, right? And then Chikitsa Vidhi. So in Chikitsa Vidhi, again, it is not enough to just give some medicines. Your prescription actually should represent counseling, lifestyle modification, diet, internal medication, external therapy, and surgical procedure. And when I say counseling, it does not mean all the diseases require counseling, but here counseling means counseling for the diet also. That is also a type of counseling, which we don't do at all. We never tell the patients what are the specific diets we have to tell. And that comes under counseling, and that should be written to the patient so that the patient remembers. So these are certain things, which we should, and the student will learn. So it is the prescription should have counseling. The prescription should have lifestyle modification. It should have diet. It should have internal medication, external therapy, and surgical representations. Everything is there. And having done the Kriya Krama, now that you have decided the treatment, the lifestyle modification, the diet, everything, now you have to wait and see what the patient follows. So you will advise the patient to do it for maybe 1 week or 10 days and then say, come back after 10 days. So after coming back, when the patient comes, you may ask, did you take the medicines properly, or have you skipped anything, or did you find some medicines to be very difficult to take? All of these are some questions. So based on that, you will see the phala. Also, how much changes has happened within this time frame of first follow. And you will also see each medicine, has he taken properly or not. That is also very important. And if it is not being taken properly, you will have to modify the medicines. So in the first follow-up, you also do that. Or if the disease has not changed at all, or it has only changed to a little extent, then you may have to change the medications. This is how Ayurveda works, right? So that same picture is, or same representation is done virtually here. And you will see the patient's response. So the patient is saying Vata Purna Dhriti Sparsha is still present, but the swelling has reduced. The Prasarana Akunchanayoho Pravritti Savedana, that is also reduced. So what is still persisting, you will concentrate on that particular symptom and give medicines accordingly. Then, so as you have to concentrate on this particular, which is Vata Purna Dhriti Sparsha, your modification would be like this. So advice to stop Varanadi Kashayam and Ingvachadi Churna. Advice to stop Udvartanam, Upanaham, Abhyanga. So it is based on the inputs that you get. And that is how, and that is what is there in the Phala module. And then comes the Anubandha. In Anubandha, it is nothing but the follow. How many follow-ups the patient has come. So after giving the Phala, what is happening in the second follow-up? What is happening in the fourth follow-up? Everything is represented here. And finally, what you get is this. After the treatment, what has happened to the patient? From which stage of the disease to which stage has the patient gone to? So it is also important for a student to know, what are the treatment goals? Like when you're treating a chronic condition, maybe, some diseases like senile diseases like Alzheimer's or some other conditions wherein you very well know, or MS, multiple sclerosis, you very well know that you cannot cure the disease. So your treatment goal should be at least to make the patient, the quality of life improvement may be a goal, or maybe make the patient be independent without depending on others. That may be the first goal that you may take. So based on that, your treatment plan will also change. So what is to be expected out of that particular disease treatment goal? That is also an important learning that a student should know. Student should never think that all the treatments for all the diseases is cure is the final outcome. No, that should not be there in the mind of the student. So based on that, you will also, so here it is a very clear representation of from where this patient has come. So previously, it was a disease condition. From disease condition, the now patient after treatment has moved to low disease activity. Still, there are more things to be done, right? So, which can be done by giving more and more medicines or modifying the treatment, by which the patient may still achieve better things like disease-free state or healthy sometimes. So, these are all very, very important learnings that you get. So which are represented under these six, tabs. And this is how the pariksha of or whole treatment module is like. So with this, this is a very short presentation of how this AyurSIM module is. And this is the same for all the 54 cases that we have now. And it is already open for everyone. Everyone can use it for free. You just need to register and create your uh, username and password, and the whole AyurSIM portal is yours. And I hope with this demo, you would have understood how deeply we have thought about. And yes, of course, there are many things which still needs to be, improvised. There is scope, a lot of scope for improvement, but yet at least as a first step, as Dr. Anup Thakkar sir was saying, we have at least attempted in doing this. So with these words, I complete my demo. And if you have any queries, uh, you may ask.
Thank you, sir. Thank you for the demonstration. Now, the session is open for discussions and raising your questions. The participants can raise the questions and express their comments through Q&A box, question and answer box.
Yes, please, you can give your questions. Are more cases going to be added in future? Yes, we are going to add more questions. More cases. This was a first attempt, so it was only 54 cases. Can you say in short what the presentation about? It is a representation of a virtual case, a virtual clinical case. So it is basically for students to learn, ultimately made for undergraduate students. But yes, it can be useful for postgraduate students and also practitioners. Uh, how can a teacher use it for how a teacher can use it for practical examination purpose? Yes, sir, this is an important and important question. Yes, as there are many modules and different diseases represented here, even the teachers can show it in their virtual VR room and take the students there for clinical classes and uh, explain the different types of examination. Like if you're teaching a neurological examination, or if you're teaching musculoskeletal system, you can show open a particular case which represents musculoskeletal system and show how that is done. And you have all the pictures and animations, everything represented very clearly there. So the student will be able to learn it efficiently. Can this method be used for NLHP as mentioned? Yes, of course, because we are using a lot of varied methods. We are not monotonous, uh, you know, um, we are using a very interactive method. So this can be used for that, surely. And as this comes directly from the ministry, I hope NCISM will also support it. And already there have been efforts that, it'll be in future, they may even, tell you to use these modules, because the ministry wants this to be used by all the students. Only then this portal becomes a success. The portal link is already there, madam. If you have registered to that, uh, then you can right away use it. Sir, can you discuss any one case here? Uh, one case is actually it is difficult to show one case as a whole. It will take a lot of time. So as I showed, all the diseases are represented in this manner only. Can a teacher assess how a student performed? And yes, in future we will also have time that working behind. So this teacher may be able to assign certain cases to the students and also see where the students are going wrong, or how much time the student is taking to answer a particular module. And they will get all the picture of how the student performed. Yeah. Sir, method of assessment of giving marks. Yeah, this is also a good suggestion, sir. And we are also planning, yeah, that, to show how many attempts were made by the student and within what time, because you're supposed to do each activity in a stipulated time. How much time was taken by the students to complete one activity? All of that will be, shown in the future. For particular case, for example, knee joint, as you mentioned, based on diagnosis, we diagnose them. How, sir, we should prescribe the formulation? Yes. So after you have diagnosed the condition, uh, you may have a lot of list of kashayams, list of churnas, or list of arishtas or vatikas, everything which comes to your mind. Those same picture is given here. So there will be a whole list, which is called as a pool, a general pool. From that general pool, you are supposed to choose medicines which are suitable to that particular patient. So maybe that particular patient, because of Pitta Prakriti, you may not be able to use some particular medicine. I'm just giving an example. Some particular medicine, even if it is working well in that particular disease condition. So you may have to choose some other medicines. So based on ama, dosha, and sthana, and various other logics, you can narrow down your whole list to maybe 4 or 5, which you will ultimately be using for your treatment and internal medications.
So, Dr. Shyam, many people are asking for a little bit more explanation.
Okay,
Can
sir.
you go through one case? Especially, there are doubts about how we move from diagnosis to treatment. Questions about differential diagnosis. So, maybe if you can take a case show from the diagnosis part, how we are addressing the avasthas, how the medicine is selected. It may be.
Okay, sir. Okay. I'll just go back then. So yes, hope you can see the screen. So you have got the whole picture of the patient from the data you have procured from Rogi Pariksha and Roga Pariksha, and which based on which you will be doing the Aushadha Nirupana. So the inputs from Rogi Pariksha and Roga Pariksha is carried forward. And this idea is there already in your mind when you're choosing the Aushadha Nirupana. So the representation, the framework here in AyurSIM is made in such a manner that the student learn use medicine in a very rational manner. There should be a rationale behind choosing each medicine. They should not be, randomly choosing any medicines or randomly choosing any medicine. Just because the medicine is available, they should not be, prescribing it. So that is the learning. So that is why first they have to choose the line of treatment. So when they're choosing the line of treatment, what are the major things that they should consider? So when it comes to ama vikalpa, so that is what is called as ama vikalpa. So first is the state of ama. What is the state of ama in that particular disease? So when you consider state of ama, there are three major things that you consider. That is the quantity of ama, the quality of ama, and the type of ama. For example, quantity means alpa ama. If the ama is very less, you may choose some shamana type of treatment rather than going to a shodhana treatment. But if the ama is bahu ama, then you would invariably choose a shodhana treatment than before giving a shamana chikitsa. So that will give you the idea of which type of treatment you are going to choose. Again, the quality is also very important. Quality means chala ama or achala ama or leena alina ama. For example, if a particular disease has leena ama, then you may have to do some deepana pachana, some sroto shodhana to make the leena ama a chala ama. so that when the lena ama becomes chala, then you can easily bring that ama to the koshta and purge it out. And this is not there. When this logic is not there, you may not choose the treatment appropriately, and uh, you may not properly get the results. And then also, like, you will also have to see what type of ama is it. Is it a Vidagdha ama or Vishtabdha ama? That is also very, very important. So based on that also your treatment. So that comes under ama vikalpa. Then comes the dosha vikalpa, wherein you are supposed to see what are the uh, doshas. Is it the samsargaja dosha? And if in samsargaja dosha, which is the predominant dosha? That also you will decide. And again, under dosha vikalpa comes the guna vikalpa, which means which are the gunas which are important in that particular kind of. And what is the pradhanyata of rasa in that particular disease? So Madhura and Tikta are the important rasas, especially maybe in a condition like osteoarthritis, where you're treating, because you may have to do the Brahmana. And Tikta is also good for giving the strength. So that is why you may choose these rasa. So Guna Vikalpa, here it says Ruksha followed by Ushna. So first you will do some Ruksha to eliminate the Ama, and then Snigdha and Ushna you may use, which is to eliminate the Ama and then do the Shodhana, which is the general line of treatment that you adopt, because the doshas were Vata and Kapha. And again, the line of treatment. So you have done the dosha vikalpa. So the line of treatment would be the pachana, which is again a type of ruksha. And then vata shamana. That is why you use madhura and piktarasa. So in bahya, what you would be doing the treatment. So first you will be doing udvartana to do the rukshana, or you may choose dhanyamla dhara to do the rukshana. For that, what you would do, use the medicine. That also may be decided. And then later on, if you see, you will come to the snigdha type of treatments, which is like, upanaham or abhyankam, janu pichu. But these are all coming later. So there is a particular way or logic in using this method. So this is also very, very important. So it is mentioned here, please select the correct items from the table. So correct items are to be chosen like this. You have to tick it here. So in this particular disease, if a particular type of treatment works properly, if it is correct, it will give you a green signal, or it will be represented as red. So the student will able to know or learn that this is the type of treatments which are used in this particular diseases. Of course, there may be other methods of doing it, but this is the general protocol that we follow. That is what is represented here. And in Abhyantara, which are the type of yogas you will use? Is it the Kashaya yogas or the Gulikas or Arishtam or Lehyam? All of this will give you. And here, as it is not Shastra Sadhya, it is given as blank. So having done the Aushadha Nirupana, now, then again, you have to go to the Sthana Vikalpa, wherein you see certain diseases, it is very important to understand the Roga Marga. Because see, when certain diseases are in Madhyama Roga Marga, the approach is a bit tricky. You may have to use certain different methods or specific methods of handling it. So that is why you have to also see which is the Roga Marga affected, or how the disease has manifested. What is the Roga Marga of that particular disease? And again, Anga is important, because looking at the Anga, you may be able to decide how easy it is to approach that place. Again, Pradesha is important, because at different places, like if it is Abba in the Ura Pradesha, it is Kafasthan. So that sthana of that particular uh, pradesha is also very, very important. And again, not only that, avayava is also important. So when you have decided and when you have considered all of them, your treatment is very precise to the point and very easy to administer. You will not have any doubts in that. And based on that, you will do the internal medications. You will see, this is the medicine pool that I was talking about. So here a whole list of medicines are given. So kashayams like Varanadi Kashayam, Rasna Saptakam Kashayam, Maharasnadi Kashayam, Rasna Irandadi Kashayam, Dhanvandar. So many Kashayams are there, which you can maybe choose, or you have the options of choosing. In Churnam, you have Shadanga Churna, sorry, Shadharna Churnam, you have Inguvachadi Churnam, Vaishwarna Churnam. In Snehas, you may have Sahacharadi Medgupakam, Gugula Tikta Ghritam, Mahatikta Ghritam. Kulikas, you may have Yoga Raja Gugulu. So all of these are there. But which will you choose among them? Again, you need to run your logic. You have to consider the dosha aspect there. And only when it fits into the dosha, the sthana, and ama, only then you will be able to choose that particular formulation. It may be suitable to dosha. A particular formulation may be suitable to dosha, but it may not be suitable to sthana. So when you choose them here, it may stay here. So from the dosha tab, you are supposed to so you have a set of medicines in dosha tab now. So after having selected all of that, only the sthana tab will work. So now you have a whole list of medicines here. And from here, you have to choose. You have to choose to sthana. So see, Maharasnadi Kashayam, even though it is used or it can be used in this particular Vyadhi, the sthana may not support it. So that is why it is going back. Rasna Irandadi Kashayam, all of that are not suitable to the sthana. Like mainly we give Rasna Saptakam for Kati Pradesha. Like that, each medicine may have some certain, specific areas where you can give that medicines to. Then from sthana, you will choose if it is suiting for the ama also. And only when it is suiting to all, it will be selected for your treatment. Similar is external therapy, which has a pool of therapies. And based on dosha, sthana, and ama, you have to choose all of them and make the final list. And having done both, then you will look at, again, it is not enough that it fits for dosha, ama, and sthana. It should also work well with dusha in that particular vyadhi, or it should help or should be suitable to that particular desha in that particular bala, kala, anala, prakriti, vaya, sat. So you know all of that. So it should suit to all of that. See, this is the representation. So Varanadi Kashayam is suitable for like this. You will get a red tick and a green tick. So red tick means it is not suitable for bala and kala maybe like that. So whole picture you will get, and there may be orange tick, which means not completely, but partially. So that will give you an idea of how much the medicine is suitable to that particular condition. And based on that, you will go to the Kriya Kala. Again, when you're going to Kriya Kala, you are supposed to decide at which stage the disease condition is. Is it at the Prasara stage? Forget Sanchaya, because Sanchaya normally or very rarely do we get. Or is it at the Prakopa stage, or is it at the Prasara? Because your treatment again varies according to that. And Prasara, again, Sthana Samshaya, Langhana, and Vyayama. So, your advices are very, very different at each place. So, that is the learning that you get in Kriya Krama. And with this, you check when you are administering the treatment, what happens, how much was the compliance of the patient, and what are the symptoms which have reduced, or are any symptoms there which have increased. And based on that, again, you will modify the prescription. So this is the patient response. And based on the patient response, you will revise the prescription. So this is how the logic. So there is a logic behind you choosing the medicines, your choosing of treatment, everything. That is what we actually aim to do here. I hope this is clear for you now. So now, yeah, let me see if there are any other questions. Appreciate. Thank you for your appreciation. That is also, very important for us, because this is what keeps us, working for it. And again, having done this, um, this virtual platform, we would never say that this is a replacement for a real case. Seeing a real case is seeing a real case. Like, it makes a difference. But in case where you never see a patient at all, in such cases, at least a virtual case, and that too represented with a proper data, is very, very important, because in future, if you encounter to see such patients, you should be able to treat them. That is the whole point. We would never say that, virtual platform as this is a replacement for clinical training. We would never claim that, because that is a very big claim that we may be making if you do that. We know the limitations of virtual, but still within that limit, how good we can train the students, or how efficiently, or how differently, using with different methods, we can train the students. That is what we are aiming at here.
Okay, thank you, sir. I hope there is no more questions. So now we can move to the VR. So next is the demonstration of virtual reality component of AyurSIM platform, which I will be doing for you. I will briefly talk about the VR technology, explain the VR component of AyurSIM, and try to give you a brief picture of how VR can assist your Ayurvedic learning. Virtual reality or VR is a new and growing technology that utilizes the latest groundbreaking developments in imaging to present a virtually designed environment to the user and provide an enhanced experience which feels very similar to the reality. Although the applications of VR is more widely adopted in entertainment, If developed well, it can be a powerful tool in the education also. When used in medical education, it can serve as an ideal trial ground for the students to learn procedures effectively and repeatedly. Practice the procedures to build confidence before they are exposed to actual patients and make effective learning accessible to more students. It basically requires a VR device that you must wear on your face and a very carefully prepared scenario, which was carefully designed using the advanced techniques. In AyurSIM, we plan to incorporate different Ayurvedic procedures, preparations, and practical steps into the VR so that the students can get an experience of these before actually performing them in the real scenarios. Since there are limitations, as before said by Ramanohar sir, to having a complete experience of VR through an online program like this, after showing you the device and its parts, we will show you on the screen how the scenario will appear to you when you wear a VR device yourself. So let's begin the demonstration. So this is the VR headset. This you have to place on your uh, head and adjust. So in this there is a lens. So through this lens you have to see, and when you look into that, you can see. So I will demonstrate what the visuals will be seen by you when you wear this. So in this, you can also hear the audio. So the comments will be given. So first, it was to place the earplugs or the cotton in the ears, and now it's to wipe the face with a cotton towel and to place the cotton towel on the table. After that, the VR will tell the command to do the abhyanga. So the attendant will bring the warm hot oil to you, and later you have to apply it on the face of the patient. So now the audio will be playing that. Dip the finger in the oil and see the hand markers. So you have to follow the commands. After that, we have to ask the patient to sit down, and the iPad is placed on the eye to cover the eyes. So we have to take the iPad and cover the eyes, and then we have to remove the head pillow from the table. And the next command is to give the Nadi Sweda using the Nadi Sweda Yantra. So we have to place it on the blue mark so that the next command will be played. So now we are giving the Nadi Sweda using the Nadi Sweda Yantra. Now, next we have to do the Dhumapana. So first command is to take the Dhumanetra, then Dhumavarti, and place the Dhumavarti into the Dhumanetra. And we have to administer to the patient. So in this, why we are doing this procedure is also mentioned. So the students can hear and understand why we have to do all these. Next is to remove the iPad and asking the patient to lie down on the treatment bed. So next is to do the Pradhana Karma. So the Pradhana Karma begins with the administration of the herbal medicine into the nostrils. So it is made lukewarm by the attender. So then we have to adjust the leg pillow position and extend the neck. And after so the hand positions in accordance to the Ashtanga Hridaya are mentioned here. So when you wear this VR device, you can hear to place your left hand and elevate the nose tip with the middle finger and close the left nostril with your ring finger, and to instill the medicine in the left by closing the right nostril with your forefinger. Then the patient is allowed to inhale the medicine, and we have to place the gokarna on the table. So after instilling the medicine, next is the mardana. So we have to do the massage over the face. So next the patient will be spitting out the medicine as well as the sputum. Then we will ask the patient to sit down and we will proceed to the Pashat Karma. Then again we have to cover the eyes with an iPad. Then the Nadi Sweda is administered to the patient in neck and head region. This is to ensure a thorough cleanse. Then we have to keep back the Nadi Sweda Yantra. And next we have to administer the Dhumapana. So we have to take the Dhumanetra and then give to the patient. Next, we have and have to place it on the table. Next, we have to give the glass containing Sugoshna Jala to the patient for doing the Gandusha. Then we have to place back the glass on the table. Then we have to apply the Rasnadi Churna in the vortex. So the hand marker will be marked there. So you have to place your hand, and the patient is asked to take rest. By this, the Nasya Karma procedure is complete, and there are some multiple choice questions. So you have to answer these. So that was a sample VR Nasya demonstration. Our SIM team is working on adding more scenarios to the platform, ultimately aiming to provide a comprehensive training experience to Ayurveda students by using AyurSIM. So please don't miss a chance to experience AyurSIM in the VR next time. Thank you. So by this, we come to the end of AyurSIM online training program. So if you are having more queries, you can now ask in the QA chat box. So you people can buy a VR. It's not that much expensive. We can get the basic VR with the amount of 20,000. So as you can buy a mobile phone, it's simple, not that cheap, but you can afford it. It will cost only a price around 20,000 for the basic model. You can even buy the high end models. It will be around 1 lakh. So as we can go for different ranges of mobile phones, you can also go for different ranges of VR devices. So you can also practice VR in the home, but I would recommend if you practice it in front of a teacher first, and then you can practice in your home.
So there are some more questions in the chat box. Can this be, can we purchase the virtual reality equipment? So this was, we gave the answer now. I mean, VR with other procedures, yeah. So this can be purchased by the institution where you work, and then maybe students can work on it. That may be one method of doing it. can final year UG students use? Everyone can use it. Whoever registers to this platform can use it. This is primarily made for BMS students. How can we attach the equipment with the website? So actually, the VR module is developed only for NASYA as of now. So in future, we may, connect it to AyurSIM, and by then you will be able to use it. Dr. Medha, do you want to tell something about it? I think she's not there now. But
Sorry, sir. Sorry, sir.
yeah,
I missed the question you raised.
they are posing a question like, how can this VR module be connected to AyurSIM?
So we are planning to upload it into the AyurSIM portal. So there will be a tab for VR.
Yeah.
So you people have to just connect a VR headset, how you will connect the normal headsets, and then you can play. Play the VR of Nassim.
So hope that question is answered. Are VR models going to be available for? Yeah, we are planning to bring VRs for procedures which are difficult to learn otherwise, which requires actual, practical hands-on experience. Such things we are planning to bring it through VR. VR is one method of doing, you know, practical demonstration. There are other methods like mannequins also, as Dr. Ramanovar sir was saying. So similarly, some things will be as mannequins maybe in future. How much is the price of this platform? See, this platform is free for everyone to use. So it does not cost, this does not charge you anything. It's for free. So hope we have completed all the questions.
Yes, sir. Okay, sir. By this, we come to the end of AyurSIM online training program. I take this opportunity to thank our panelists, Dr. Anup Thakur sir, Dr. Mandip R. Goyal madam, Dr. P. Ramanohar sir, and Dr. Sham Sundaram K. sir, who made this program happen and whose sessions help the delegates understand the AyurSIM platform. I thank the technical staffs at Amarda ICTS and Create, who not only designed the platform but also played a crucial role in organizing of this online training program. Finally, I also thank all the delegates who joined today on behalf of Team AyurSIM. Before we conclude, let me remind you about the feedback form link that you have received in the email, along with the joining link. To those who submit the feedback form, a certificate of participation for the online training program will be mailed to you within a few days. So, this is for those who haven't received the mail, please scan this to submit your feedback form. So let us conclude. Once again, thank you everyone